Herpes Simplex Virus or HSV is a common virus. It causes sores and blisters. These sores can appear on the mouth or genitals. HSV is easily spread from person to person. Many people have HSV but don't know it. They may not have symptoms or their symptoms may be mild. HSV can be managed with medication. It is important to talk to your doctor if you think you have HSV. There are two main types of HSV, HSV1 and HSV2. HSV1 usually causes oral herpes, also known as cold sores or fever blisters. These sores typically appear around the mouth. HSV2 usually causes genital herpes. Genital herpes causes sores on or around the genitals. However, both types of HSV can infect either area. This means you can get HSV1 on your genitals and HSV2 on your mouth. It's important to know which type you have. This helps determine the best treatment and management plan. HSV spreads through direct contact. This can be skin-to-skin contact with an infected person. You can get HSV from kissing someone with a cold sore. You can also get it from having sexual contact with someone who has genital herpes. You can get HSV even if the person doesn't have any sores. This is because the virus can be present in the skin, even without visible sores. It is important to practice safe sex by using condoms. Also, avoid contact with sores or blisters on someone's body. HSV symptoms vary from person to person. Some people have no symptoms at all, others have mild symptoms. Common symptoms include blisters, which are small, painful blisters filled with fluid. They can break open and ooze. The area around the blisters may itch or tingle. Some people experience flu-like symptoms such as fever, headache, and muscle aches. Oral herpes usually causes sores around the mouth. Genital herpes usually causes sores on the genitals. If you experience any of these symptoms, it's important to see your doctor. Section 5. Managing herpes treatment options. There's no cure for HSV, but there are medications to manage the virus and its symptoms. Antiviral medications can shorten outbreaks. They can also make outbreaks less severe. These medications work by stopping the virus from multiplying. This helps the sores heal faster. Your doctor may prescribe a daily antiviral medication. This is called suppressive therapy. It can help prevent outbreaks. Section 6. Living with herpes, lifestyle and management. Managing HSV involves medication and lifestyle changes. Here are some tips. Avoid intimate contact during outbreaks. This prevents spreading the virus to others. Use condoms when you do have sexual contact. Condoms can reduce the risk of transmission, but they don't eliminate the risk entirely. Maintain good overall health. This includes eating a healthy diet, exercising regularly, and getting enough sleep. Manage stress. Stress can trigger outbreaks. Find healthy ways to cope with stress, such as exercise or meditation. Section 7. Potential complications of HSV. Herpes simplex virus, commonly known as HSV, is a widespread virus that affects millions of people worldwide. While many individuals may experience only mild symptoms or even remain asymptomatic, it is crucial to be aware of the potential complications that can arise from this virus. Most people with HSV have mild symptoms. These can include occasional outbreaks of sores or blisters around the mouth or genital area, which can be managed with antiviral medications and proper care. However, it is important to understand that HSV is not always benign, but HSV can cause serious complications in some cases. These complications can significantly impact a person's health and quality of life, making it essential to recognize the signs and seek timely medical intervention. Encephalitis is a rare but serious complication. This condition involves inflammation of the brain, which can lead to severe neurological symptoms such as headaches, fever, confusion, seizures, and even coma. Early diagnosis and treatment are critical to prevent long-term damage. It is an inflammation of the brain. Encephalitis caused by HSV requires immediate medical attention and often involves hospitalization and intensive care. The prognosis can vary, but prompt treatment can improve outcomes. Keratitis is an inflammation of the cornea, the clear front part of the eye. This condition can cause pain, redness, blurred vision, and sensitivity to light. If left untreated, keratitis can lead to more severe vision problems, including permanent damage to the cornea. It can lead to vision problems. Regular eye checkups and prompt treatment of any eye-related symptoms are essential for individuals with HSV to prevent complications and maintain good eye health. Neonatal herpes is a serious infection that affects newborns. This condition occurs when a baby is exposed to HSV during childbirth. which can happen if the mother has an active infection at the time of delivery. Neonatal herpes can lead to severe complications, including brain damage, organ failure, and even death. It occurs when a baby is exposed to HSV during childbirth. Pregnant women with HSV should work closely with their healthcare providers to manage the infection and reduce the risk of transmission to the baby. In some cases, a cesarean section may be recommended to prevent neonatal herpes. If you have HSV and experience any unusual symptoms, seek medical attention immediately. Early intervention can help manage complications and improve outcomes. Stay informed, stay vigilant, and prioritize your health and well-being. Section 8. Diagnosing herpes simplex virus. Diagnosing HSV, or herpes simplex virus, is a crucial step in managing and treating the condition effectively. It involves a combination of clinical evaluation and laboratory testing to ensure an accurate diagnosis. Diagnosing HSV involves a physical exam and laboratory tests. During the physical exam, the healthcare provider will carefully inspect any visible symptoms, such as sores or blisters, which are common indicators of the virus. Your doctor will ask about your symptoms and medical history. This includes inquiring about the onset, duration, and severity of symptoms, as well as any previous occurrences of similar issues. They may also ask about your sexual history and any potential exposure to the virus. They will examine any sores or blisters. This examination helps in identifying the characteristic lesions associated with HSV, which can appear on various parts of the body, including the mouth, genitals, and other areas of the skin. Laboratory tests can confirm the diagnosis. These tests are essential for distinguishing HSV from other conditions that may present with similar symptoms. These tests may include polymerase chain reaction or PCR test. The PCR test is highly sensitive and can detect even small amounts of the virus's DNA, making it a reliable method for confirming the presence of HSV. This test detects the virus's DNA in a sample of blood, fluid from a sore, or a swab of the affected area. The sample is then analyzed in a laboratory to identify the genetic material of the virus. Another test is the viral culture. This method involves taking a sample from a sore and attempting to grow the virus in a controlled laboratory environment. This test involves taking a sample from a sore and growing the virus in a laboratory. The viral culture test can take several days to produce results, but is useful for confirming the type of HSV infection. Early diagnosis and treatment are important. Identifying the infection early allows for timely intervention, which can help reduce the severity and frequency of outbreaks. They can help manage symptoms and prevent complications. Effective management includes antiviral medications, lifestyle adjustments, and ongoing medical support to improve the quality of life for those affected by HSV. Section 9. Preventing herpes simplex virus. There's no vaccine for HSV, but there are ways to reduce your risk of infection. Practice safe sex. Use condoms consistently and correctly every time you have sex. Communicate with your partner. Talk to your partner about their HSV status. Avoid contact with sores. Don't kiss or have sexual contact with someone who has a cold sore or genital herpes. Manage stress. Stress can weaken your immune system, making you more susceptible to outbreaks. Practice stress-reducing techniques. Section 10. Ongoing research and future directions. Scientists are constantly working to develop better treatments and prevention methods for HSV. Current research focuses on developing a vaccine. A vaccine would be the most effective way to prevent HSV infection. Researchers are making significant strides in understanding the virus's structure and behavior, which is crucial for creating an effective vaccine. This involves studying the virus at a molecular level, identifying potential targets for the vaccine, and testing various formulations in preclinical and clinical trials. In addition to vaccines, new antiviral medications are being developed. These medications aim to be more effective in reducing the severity and frequency of outbreaks. Researchers are exploring various compounds and their mechanisms of action to find the most promising candidates. The goal is to create drugs that not only suppress the virus but also have fewer side effects, making them safer for long-term use. Researchers are exploring new drugs that are more effective and have fewer side effects. Another exciting area of research is gene editing. Scientists are investigating the possibility of using gene editing techniques to eliminate the virus from the body. This involves cutting-edge technologies like CRISPR, which can precisely target and modify the viral DNA within infected cells. If successful, this approach could potentially cure HSV infections by removing the virus entirely. Scientists are investigating the possibility of using gene editing techniques to eliminate the virus from the body. This revolutionary approach could change the landscape of HSV treatment, offering a permanent solution rather than just managing symptoms. The research is still in its early stages, but the initial results are promising, and ongoing studies continue to refine these techniques. These advancements offer hope for a future where HSV is no longer a significant health concern. The combined efforts in vaccine development, antiviral medications, and gene editing represent a multifaceted approach to tackling HSV. As research progresses, the medical community remains optimistic that these innovations will lead to groundbreaking treatments and possibly a cure, significantly improving the quality of life for those affected by HSV. Section 11. Conclusion: Understanding and living with HSV. Herpes simplex virus is a common infection that can affect anyone. While there's no cure, HSV can be managed effectively with medication and lifestyle changes. Understanding the different types of HSV, how it spreads, and its symptoms is crucial for prevention and management. Open communication with partners, safe sex practices, and regular medical checkups are vital for controlling the spread of HSV. As research progresses, we can hope for even more effective treatments and eventually a cure for HSV.